Hi, I'm Mark from Capital Podiatry. Today I'm going to be talking about arthritis in the feet, in particular in the midfoot. So there's a variety of arthritis conditions that you can get. One of the most common being osteoarthritis, which is basically just wear and tear in the joint. There's also a whole range of inflammatory arthritises. Some of the most commonly known would be rheumatoid arthritis or psoriatic arthritis. The one I'm going to focus on is osteoarthritis. So if you look at the middle of the foot, it's you have a whole stack of joints here. So everywhere one bone meets another bone is a joint, so it's riddled with them, and you can get a lot of issues with arthritis in here. So there's a condition called dorsal midfoot interosseous compression, which is a fancy way of saying that the top of these joints are getting squashed. So this generally happens when the arch is dropping, which causes pressure at the top of the joints. Now, this arch dropping can be changes to the foot itself, but more commonly is just a function of gait. So when you walk, put weight on the foot, most people's feet will roll in and flatten out to some degree, which is what it's designed to do. And then as it goes forward, it's supposed to roll back out and lock up again. But for some people, they don't get the second part of that. It rolls in, flattens out, and stays there through the gait cycle, which causes a lot of pressure on the top of these joints, and it starts to wear and tear. When you get this happening, then you find people get pain at the top of the joint. They also get the joints themselves can seize up and stop working properly, and you can even get a condition where called lipping, where if there's enough pressure on the joint for long enough, you start getting calcification over the joint, and on an X-ray, it looks like wisps of bone going over it. Now, the number one approach for treating this is to support the foot and reduce that lowering of the arch, which is obviously orthotics. They work really well for this. Plus supportive shoes. You don't want to be getting around in ballet flats, thongs, anything that's not supporting the feet. We also do mobilizing the joints in here, and that in itself will give a lot of relief. And the with the inflammatory arthritis, the approach is pretty similar. So again, you need to support the foot. I find gentle mobilizing helps with them as well. Difference is we need to work with the GP as well, because with inflammatory arthritis, they often need medication. So if you're getting pain on the top of your foot and you might be feeling some lumpy calcifications as well, come and see us. I'm sure we can help you.